receiving those SNAP benefits so that we can, facilitate those services and receive reimbursement for that. Um, so there were some changes that were passed with passage of HR1. So we're going to go over that. But so what we're going to accomplish here today is we're going to understand the rules behind an ABOD, and mainly what those work requirements are, having that 80 hour monthly work requirements. We're going to go over what changed specifically in HR1 and what those impacts are, have been to not only the SNAP recipients, but also the state agencies who are responsible for administrating this, and then also what the potential impacts are as as a SNAP ENT provider. So we're going to also talk about how SNAP ENT is utilized for meeting that work requirement, and then things that we could be looking at as a program provider to possibly strengthen our program and be a greater asset to not only the state as a state partner and provider, but most importantly to your participants to make sure that you're supporting them throughout this process. So our agenda, real quick, we're going to have a quick poll. We have a couple pit stops throughout this presentation just to ask some follow-up questions. We're going to talk about, again, time-limited recipients, what's changed, the RIC requirements. Oh, also non-compliance, what happens when participants aren't meeting that work requirement. We'll have a discussion about the barriers that you're seeing your participants face as it relates to meeting those work requirements. And we might be able to have a little bit of a discussion on things and strategies that you as a provider have been doing. How to meet those hours through work through SNAP ENT. And again, we're going to go over just kind of the resources that you want to make sure that you're looking out for, not only in your local community, but with your state agency, FNA's resources, just to make sure you're covering all your bases and you understand the requirements in the territory that you're working in. So real quick, and we can just do this in the chat. I've got the first question, and what I'd like to know is when you're looking at where your caseloads are in your current programs, how many of your participants have become newly subjected to the ABOD time limits because of HR1's implementation? And it's fine if you don't know, but if you know that very few or none, that you haven't been impacted that much, it's just very few. Some, a lot of your participants that you serve have been impacted. Just trying to gauge how your programs have been experiencing these changes. If you can just maybe drop that into the chat, and we'll just see what we got here. No, let's see.
You can also come off
I can
and
speak.
share.
Yeah. I was like, Riley, I'm just curious because I think you're a little bit closer maybe to the numbers. Have we really started to see this impact within our own programs across all the states?
Yeah, and I think one thing to differentiate is those that have become kind of newly subject because of kind of the categories that they are as a participant versus those that live in areas that used to have an ABOD waiver that have now become subject to that. So I think we're seeing some of our sites that previously had a waiver for these work requirements that are now subject.
Yeah. And Andrew, I was kind of curious because I mean, you're doing a lot of work with other providers and you're doing work with state agencies. Have you had what have the discussions been around this topic that you've kind of experienced? If you could share.
Sure. So I think a lot of states are states who didn't already have a waiver for ABODs, and those are states that were granted a waiver by the federal government because they, for whatever reason, mostly because they didn't have enough jobs available in the state to meet the number of ABODs they had in the state. So for states who didn't have a waiver, areas that didn't have a waiver, it's really just adding in the expanded requirements. So for people who are between 55 and 64, and people who have dependents between 14 and 18. So that was a little bit of an expansion there. So they're focused on those. The other population, the other states are ones that had a full waiver for all of these requirements. So New Jersey already had to implement, and it's been a bumpy road for them because it's all these requirements are new for them, right? And California just went live with ABOD requirements as of June 1st. So I think that those states have just a lot bigger hill to climb and are still understanding how internally things work. Um, but the partners that we work with, the frontline folks, third-party partners, are really working to strategize around how to support people and help them maintain their benefits. Um, and also, and I'm sure Aaron, you'll get to this. I don't want to step on your toes, but
Right.
as we've kind of seen with a lot of these types of requirements, it's more a documentation requirement than a participation requirement. So really, it's just understanding those processes and helping people meet those processes as much as the requirements themselves.
Yeah, great. Thanks so much. So second question, how confident are you in the current ABOD work rules? And the great news is if you're brand new to this or you're still learning, we're going to try to break it down in very simplistic terms here to help you better understand that a little bit better. So um, some still learning, not sure, still learning. Okay, that's great. So this might be a great session for you, just to kind of get a little bit more acquainted with what this is and how it's impacting your participants. But again, how can you, as a provider, be a better partner to your state agencies too? And how this is a great opportunity to try to strengthen your relationship and making sure that you're having a solid program and you're all working together. So. Next slide, please. Okay, so what is a time limited SNAP recipient? And he keeps using this term ABOD. ABOD stands for able-bodied adult without dependents. And an ABOD is a work registrant who generally is 18 through the upper age limit, which we're going to go over what that age bracket range is. They are not pregnant, not physically or mentally unfit for work, and they're not responsible for a household child under the age of 14. The core issue is that ABODs face a strict time limit on SNAP. They're allowed to receive just 3 months of benefits in any 36-month period unless they meet the federal work requirements or qualify for an exemption. And so we've cited also what the CFRs are on that talk about this if you'd like to reference them. So go ahead to the next slide. So what does this mean? So, signed in on July 4th, HR 1 overhauled who is going to be subject to the time limits. And so the changes in where we're seeing more people become an ABOD who previously had exemptions. A big bracket was this age range was expanded. It used to be that the upper limit was 54. So if you were over the age of 54, you qualify for an exemption and that you were not considered an ABOD. That was raised to the age of 64. So now anyone who is in that 55 to 64 age range used to have an exemption, they will now be subjected to meeting that work requirement. Also, the dependent child care, there was a caregiver exemption that if you had a individual in your household that was 18 years under the age of 18, you could qualify for that caregiver exemption. Now it is only if it is a child in your household under the age of 14. There were exemptions that were removed, and this one affected, I know, CEO pretty heavily because the Center for Employment Opportunity serves justice impacted individuals. Many people coming out of incarceration, they were veterans. Many people were considered homeless. And so those two categories, that affected our program pretty significantly in that regard. But those exemptions have been removed. So veterans now had a previous exemption. They now are subject to the work requirement. If people are homeless, they unfortunately have this work requirement too, which is a little ironic in my mind. I know, just because it's like, if you're homeless, you probably clearly don't have a job but I get it. So, Also, former foster youth lost automatic exemptions as well. Also, the waivers that states were allowed to offer, those were narrowed down. So, where states now can only waive time limits when their unemployment rate exceeds 10%. Um, there's also where there was actually an addition of new waivers was a new tribal exemption. So members or descendants of federally or state recognized tribes are now exempt. Often can be done through self-attestation. Like this definitely is affecting like Oklahoma, and it allows that population to actually receive an exemption to where they are no longer going to be subject to this work requirement, and so that they can maintain that food security while they're in that SNAP ET program, even or not. So that was a great addition there. And then immigrant eligibility has been tightened too. So eligibility narrowed largely due to their citizens LPR and limited humanitarian categories. So we can go ahead and move to the next slide. So, basically this is just kind of giving you that example of, or explanation of how exemptions have pretty much been reduced in who was eligible, and meaning that we have a lot more people who are now going to be subject to that work requirement. So for your participants, those who have lost the exemption because of this now must immediately begin logging 80 hours of qualifying activity for each month, or qualify for another exemption in order to keep that food assistance. And a lot of people, depending on how well the states have handled the notification and how this is going to work, what we've run into a lot of times in some of our programs is participants don't really realize when this changes happen. They get something in the mail that don't really understand it because it's a really long, lengthy letter, and some of them you just throw it to the wayside, and they might not realize that they now have to meet that 80-hour work requirement each month, or after 3 months, they're going to lose their benefits. So, for participants, it's been a pretty confusing thing on their end, where if they're not really understanding what's happening. For state agencies, we've heard states really struggling with the removal of these exemptions. They have now so many more participants in their caseloads that are now subject to that work requirement. And as Andrew was speaking, a lot of it is about this documentation. So this 80-hour work requirement, they can meet that 80 hours through so many different mechanisms, and we're going to go through what those are, but that has to all be tracked. And so you have all these additional participants who now have this work requirement. They all have to report this additional information, which means they're having a lot more touch points with the eligibility staff in getting this information. And really, states have been struggling to keep up with all of that work that it entails. And that's also where states are struggling with a capacity issue, especially as it relates to ENT, because ENT is a way for their SNAP recipients to earn that work requirement and meet that work requirement. But a lot of states don't have the capacity to serve all the participants that could be enrolled in it. So states, you're seeing a lot of RFIs or RFPs coming out, and they're looking for ways to expand SNAP ENT services. And a lot of that is being driven because of these changes to the ABOG work requirements and the exemptions. So over to the right, you're just kind of seeing like what that impact is being projected to be. So we're projecting 4 million people are going to be affected who are going to lose their SNAP benefits. This is a very, very large number of people who, might be struggling with food insecurity. 1 in 8 SNAP recipients live in households that are going to be at risk of losing some of their benefits. And more than 1 million previously projected by waivers are not going to be cut off in a typical month. So you're going to have 1 million more people who are going to be subject to this work requirement each and every month that previously wasn't. So, a very key thing to remember also, though, is where this ABOD status is being screened at, and it's always on the eligibility side. So I want to, just preface that by saying, as a SNAP ENT provider, be very cognizant of your role as an ENT provider versus the eligibility team's role in establishing a person's exemption status. And if you're not sure, I want you to be very cautious of, like, you may know that they meet certain eligibility requirements or that they should have an exemption, but you always want to work with that participant to get them in touch with that eligibility team member, because that is the only person that can make that determination and make sure that they are correctly being recorded in the system as whether they are an ABOT or not. So you don't want to be kind of adding to the confusion of your participants by saying, oh, well, you're this, or you're an ABOT. You always want to know if you can verify through the state system or whatever information that you have with your partnership, with your data sharing with the state, if your participant is an ABOT or not, because then you can help them navigate that work requirement. But if it's that area of determining eligibility or understanding whether somebody is an ABOT or not, you always want to defer back to that eligibility team to make sure that they are the ones that are handling that function and responsibility. So the exemptions that still apply is that a person under the age of 18, they are going to be exempt from that work requirement, or a person over the age of 65. If the individual is pregnant, if you're a tribal member or a descendant of a tribe, that qualifies for an exemption. If you live in an approved waiver area, which is, and again, the states have to request the waiver, but it's where there's a greater than 10% unemployment rate. The states can request a waiver from FNA, and if it's granted, then the individuals living within that area would be waived from that work requirement. Medically unfit for work, or if somebody's receiving disability, obviously if you can't work because of a disability, then it doesn't really make sense to have you subjected to that work requirement. If you have a child in your household that's under the age of 14, you can qualify for that child caregiver exemption. And then exempt from general SNAP work rules. There's an asterisk there. It's like, this varies from state to state and what those exemptions are. But there are some criteria that states can receive an exemption for certain populations. And so that's, again, really understanding, what your local state plan is offering as far as exemptions in your county that you're operating in or within your state. And those discretionary exemptions. Go ahead, next slide, please. So what is the ABOT work requirement? It is an 80-hour monthly work requirement. If you read some of the rules or documentation from FNA, it's going to say something about, a 20 hours per week averaged monthly. But really what it is like they have to get 80 hours as in meeting this work requirement each month in which they've received benefits for that entire month. So even if it's in the last 2 weeks of the month that they're, really hitting their volunteer hours and their employment and training hours that they get in the last 2 weeks, great, they've met their 80 hours. But, for simplicity, a lot of times we'll say, okay, 20 hours a week, get that 80 hours in for the month. The way that you can qualify for meeting those work requirements is through paid work. So whether you have a full-time or part-time or gig work, any type of paid employment counts towards meeting that work requirement. You can also do volunteer or in-kind work. So this is going to be unpaid work in exchange for goods or housing. Those hours, as long as they're documented and can be signed off on and verified, can be used for meeting that work requirement. An approved work program. So this is where you as a SNAP employment and training provider really help in meeting that work requirement. So if your participant is in SNAP ENT or WIOA, TAA, any of these types of employment programs, their participation in that program counts towards meeting that work requirement. And then, of course, workfare or any combination thereof can be added together to meet that work requirement. So you don't have to just get it from one of these categories. They can combine the hours that they're getting in SNAP ENT with the hours that they're getting from a part-time job or the hours of the volunteer. As long as combined altogether, they meet that 80 hours, then they're going to meet that work requirement. But you can see where that creates a much greater documentation requirement, not only on the SNAP recipient, but also the state eligibility teams that have to track all of this. So next slide, please. So again, what happens if you don't meet that work requirement? So if a SNAP recipient has what they call 3 countable months within a 36-month period where they do not meet that work requirement. So a month in which your SNAP recipient doesn't meet that work requirement, you'll oftentimes hear that as being a countable month. Some people refer to it as a strike, and you get 3 strikes. And that applies to anybody when they don't have an exemption or waiver. So if they don't meet the work requirement, that's a countable month. After the third, in a 36-month period, then they will have their SNAP benefits terminated. There is a way for them to regain eligibility, and that's the complete 80 hours of work or work program activity with any 30 consecutive days to requalify. And then there is a one additional 3-month grace period is then available once you regain eligibility. But you can only do that once in that 36-month window. And so, what that means is that if somebody in that 36 months gets 3 countable months, their benefits are going to be terminated. They can get a one-time 3-month grace period. Andrew, can you explain this a little bit better for me? Because I'm getting a little hung up here. So if you complete 80 hours of work activity within 30 consecutive months, you can qualify. So that's how you regain eligibility, and then you can only do that once within a 36-month period, right?
Correct.
There we go.
Yeah.
Okay.
Yeah. And that completing that 80 hours, that's a month that person may not get benefits during that 80 hours, prove it month or whatever that may be, to kind of get back in the good standing.
Great, thanks. Also, exemptions and good cause, that does reset that status. So anytime during a person's time as being a SNAP recipient, they could qualify for an exemption that then removes that ABOD status, which can also then removes that work requirement. So if this is also where you as a case manager, as a program operator, you really want to kind of understand what's going on with your participant's life. Because if you identify that there's been a change in the status that would qualify for them for an exemption, again, you don't make that determination, but you make sure that you connect that participant with the eligibility staff so that they are being able to communicate, hey, I have had a change in circumstances. Can you rescreen me to see if I'm now exempt? And so that's where you as a provider can, because you're working with these participants on a regular basis, you can really help support them in that. Other thing that's really important is understanding whether a client has good cause for not being able to meet that work requirement. Let's say something happened and they got injured and they were put into the hospital, so they're incapable of meeting that work requirement. That can qualify for a good cause determination where that person, because of their circumstance, is getting waived. It's generally temporary, and it's going to get waived for that month. So at least they still have the ABOD work requirement technically, but because you can create that good cause reasoning for why they weren't able to meet it, then they can be exempted from that month from receiving a countable month. So again, another area where you as a provider can help understanding what's going on with your participant. And if there is something where maybe they don't qualify for the exemption, but they've had a life experience that is preventing them from being able to meet that work requirement, you want to connect them with the eligibility team to see if you can get a good cause determination for them to get that waiver for that month.
We do have a question
Next
in
slide.
the
Yeah.
chat. Calvin is asking, and he's in Washington state. He says, where are we as a whole in developing workfare sites for each county for ABODs? That is a great question that I don't know the answer to, but I can find out for you.
Yeah, I don't. I definitely don't know. I don't know if any of our other SNAP experts would have that readily available. But
I just opened the state plan. I'll get an answer shortly.
Thank you.
okay, so given what you know or what you've experienced, I'd like to hear from anybody here that's participating. Um, Can you think of, or have you already identified what is the biggest barrier that your participants are facing in getting those 80 hours reported each month? You know, do they have some supportive service issues where they're having transportation issues? Is it really just they're getting the 80 hours, but it's a documentation and reporting? Is the programs that they're involved in just not offering enough hours? Do they not understand what the requirements are? Is it because they're in poor health or they're a caregiver and not able to, to participate? One of the problems, like if you're caring for an elderly person, that's a real challenge if you're not able to, um, you know, to go out and meet that work requirement because you have a very sick person at home and you don't have alternative caregivers. That's a challenge. But unfortunately, there's not a waiver for that. And then is it because you don't have a adequate employer partnership? So just kind of sure if anybody can come off mute and just tell us what their experience has been so far.
So this is Calvin from Vallejo from Washington State, and one of the major ones for our participants is the employer partnerships. I did put the question in the chat, and someone's going to try to get back to me in regards to workforce sites because we have a lot of participants in Pierce County and King County. This is the exemption was Pierce County had always had an exemption for a long period of time. King County hadn't, so now we've got so many people in Pierce County and in Thurston counties who are looking for workforce sites. But in my understanding, coming from DSHS in the past, there was limited workforce sites in King County who wasn't exempt. So now we're not seeing any movement with workforce sites in Pierce County.
So in that case, it sounds like it's a capacity issue, right? It's like there just isn't a place for these people to go
to go vault. Exactly.
Yeah.
Yes.
There's no workfare is not currently approved in the state plan. So there may not be any ENT specific workfare sites available in the state. If you're seeing a specific need though, Calvin, and you have contacts at the state, it may be good to talk about that need and talk about how that is something that ought to be developed. Kind of curious, Calvin, where are those folks going now for services or for those types of activities to meet the requirement if workfare is not available?
That's a fantastic question.
Okay.
And it's a good question, but it also is a serious barrier for the participants looking to maintain their eligibility. So we are a nonprofit and we are providing some. And I'll bring up the ABOD notation too, which Samantha is probably very knowledgeable about when it comes to ABOD notation in EJAZ for us. But yeah, our participants aren't having luck in finding a place to go, but we're hearing about so many people that have been denied their food stamps eligibility because of not meeting the 80 hours participation.
Yeah, I think one of the unfortunate realities too is like if you live in a large metropolitan area that has public transportation, it is easier to find and access opportunities to meet that work requirement. But I think rural communities, especially where transportation might be more of a challenge or things are much more sparsely um, laid out, or there just aren't as many providers. Like, I think that's an area too where you're going to see a greater impact on this. And I know that a lot of the states that we've worked with, they're really trying to figure out how to, solve that problem and provide opportunities in rural areas that, yes, they're sparsely populated, but it is a vulnerable population that is, being, you know, subjected to this work requirement, and they're struggling to figure out how to get them connected to the services to be able to meet that work requirement.
And I think one of the go ahead.
I was just gonna
Samantha.
say we have two responses in the chat. I don't want to overlook Shakira's responses. She said there's a gap between finishing our training and employment that could put them at risk of not meeting the requirements. Okay. And then says based on a recruitment schedule, we're not always able to enroll a student at the time needed to meet requirements. Yes to both of those. I don't know if the TA team wants to speak to that, but or Shakira, you can also come off mute if you'd like. But yes. We're seeing this across the country.
Yeah, we're seeing a lot across the country of two things. One, when people finish their training program and they're not walking right into work, what can they claim? With ENT, there is job search, there's supervised job search, but that's considered a non-qualifying component, so it can't count for their entire work participation, right? There are, and I know that it can be hit or miss, so I don't want to suggest this as a universal, but if a person is able to then go to like an American Job Center or a one-stop and get some of those services, those may be able to count. And if a person enrolls in a WIOA program, even if it's a WIOA program just to do some job search, that would qualify them for that month as well. So those are options. And then the recruitment schedule, there's a gap between when somebody is enrolled in your program and when the program starts. Is that correct, Shakira? Yep. Okay. So that may be a time, I know we're not all looking to build something completely new, but that may be a time to build in, if you can find some even free online computer skills curriculums or things like that, to kind of make sure that some of those skill building pieces are happening and there's participation happening in those. That can be really helpful. You can also talk with your ENT program managers, at the state, to ask those questions, because sometimes enrollment and waiting is a good cause option, because they're not able to start yet. They're intending to, but it's just not an option yet. So that can sometimes be a good cause exemption.
We at
Andrew,
CEO
could you
have
speak a little bit
piloted.
more? Oh, sorry. No, go ahead. Go ahead, Riley. Go ahead.
I'll go real quick. We at CEO have piloted some work readiness training, Andrew, along those lines, in some of our sites where we're enrolling folks in advanced training where there's not an opening slot for a couple of weeks. And so doing some of that work readiness training up front, not only to make sure they're getting their hours, but to really prepare them for success in those advanced trainings has been something we've been trying in sites that we've just, all that to say, we've faced similar problems and had to get kind of creative on that front. But
yeah, and I was going to say, this is where you really kind of can leverage your partnerships with your state agencies, because they're looking for creative ways as well to kind of work with this. So in that example, they might be willing to allow you to braid into your already existing credentialing component some activities outside of that vocational training alone, that they will allow you to supplement in. But states have some discretion on how they want to build that out and what they will allow you to do and not. So I definitely would, like, if you have some ideas, like, hey, can we do some additional activities that to help them meet that work requirement. That's not with them actually sitting in and doing that vocational training. Like just talk it out. They're either going to say yes or no, and at least you tried, right? So it's definitely, it's always worth speaking with your agencies. All right. This is great. I love the collaboration here. So let's go ahead and move on, and maybe we'll have some time at the end to talk this out a little bit more. So again, SNAP ENT, how can they meet that work requirements? They can do it within your SNAP employment and training program. Qualifying components are going to be work experience, vocational training, workfare, education, basic education, and you can stack those together. So you can combine multiple components to get to that 80 hours. So the great thing is it's often voluntary, so participants are able to, if you're in a voluntary state, go in and just volunteer to do this and participate. It allows you to offer wraparound services because a lot of U.S. providers, you're not only running SNAP employment and training, but you're also offering other supports that could help them meet that work requirement, even if it's not directly related to employment and training. So you as a SNAP ENT provider have a lot to offer in that. And the work that they're doing in that SNAP ENT program, though, counts towards that 80 hours. So there is some caveats to that, though. We're going to cover that next. So go ahead, next slide, please. So the key caveats there is that job search. There are limitations to those components. So job search training, supervised job search, and job search training as a standalone component will not qualify for meeting the work requirement at all. So if you're only doing supervised job search, or if you are only doing job search training, and that participant is not also enrolled in another component that is eligible either through you or another provider, then that time will not count towards their job search training. Where it can count is when it is combined with another component. However, job search training must be comprised of less than half of the total required hours when it's paired with another qualifying component. And we're going to give some examples of that just to kind of highlight how that looks. And again, also, I just want to highlight that this is the federal mandate. States do have the ability to modify their plan to state that a more stringent requirement to maybe they will only allow 25% of their work requirement. I don't know if that's the case anywhere. And I don't think most states have done that because really they're just trying to get the participants their work requirements any way they can. But just know that, so this rule is the federal standard. States could opt for a more stricter rule as long as they don't, it can't be more liberal than the federal standard. So next slide, please. So as an example, if we're operating, we have a participant who is in work experience and they're in job search training. If they get 50 hours of work experience and they get 30 hours of job search training, then all 30 hours can count towards that work requirement, meaning that 80 hours, because that job search is less than half of the accompanying component, the qualifying component, I should say, of the work experience. So this would be acceptable and this participant would meet that work requirement. But if we go to the next slide, however, this would be an example where the client would not meet that work requirement and it would end up being a countable month for them. So if you had a client that in that month they did 50 hours of job search training, but only 30 hours of work experience, because that job search piece, anything over that, 30 hours and over, really, that those hours aren't going to count towards meeting that work requirement. So at best, you're looking at potentially maybe 60 hours being counted that to meeting that work requirement, but that participant still would need, with this, to come up with another 20 hours somewhere else. So this is a where you can kind of look at your program and making sure that you're in alignment there. If you have opportunities to maybe expand some services in eligible components, then you definitely might want to look at doing that. But just to give you an example, and this is where it gets a little bit tricky, because your participant might be thinking, "Hey, I've been in the computer lab and I've been doing supervised job search all this time," and they're thinking that that time's counting. And in reality, it's not. So that I think as an ENT provider, this is where you can really make sure that you're supporting your participants in the tracking of this, to make sure that they know where they are, so that they don't run into a situation where they get a countable month when they thought that they met it. So go ahead, next slide, please. So what can you do as a provider? So I think there's two things that are really important here. One, you want to look outward at your participants and making sure, are they well informed? Do they understand that they have this ABOD designation and that they're subjected to this work requirement? And do they know, what they need to do? Again, there are some people who, previously did not qualify for an exemption or had an exemption that lost the exemption, but they maybe got some paperwork and they didn't understand it. And so they could be subjected to being at risk of losing those benefits and not even know it. So want to make sure that they understand how to meet those 80 hours. And again, where you as a SNAP ENT provider, you can look to see like, hey, I think you might qualify for an exemption. Let's get you over to the eligibility staff and have you rescreened for this. Also, again, and Andrew hit on this very early on, it's really about reporting requirements and documentation. And so does your client know how to report their eligible hours? A lot of, like in some states, you as an ENT provider might have some of that burden shifted to you. I have one state in particular that says, if you're the ENT provider, you are responsible for capturing all of this and turning it in. So there is that we have that burden. Other places, it's solely on the participant. Like, in reality too, even in that state that I was referencing, the participant still has a responsibility on their end. They're ultimately the one responsible for meeting that hours. But we have seen some states put some of that burden on us as a provider to facilitate the transfer of data to the eligibility staff. But making sure you understand in your state or your county or your program how your participant can report those hours is important. Some states have great systems where there's a website and they can just upload their documents and the eligibility staff will work that. I know Oklahoma has a similar portal for that. And they also have a portal where us as a provider can upload documents that we receive from our participants. Like maybe they gave us a pay stub that we can use to verify employment and hours, or maybe they give us some, volunteer log. Like we can help facilitate that through our portal with OKDHS, but then also the participants might have a portal. Others, it might be a much more antiquated or manual process. So make sure you understand how your participants are able to get that information to their eligibility staff members so that they're maintaining that status and they don't get a countable month. Also, though, it's like look at your own program and see if there's opportunities for you either to make modifications to your existing program, making sure that your participants are able to meet that work requirement if you're able to. Some states have a requirement too that if you're going to be an employment training provider, you must be able to have a program that allows that SNAP recipient to meet that 80 hours. So make sure you understand whether or not that requirement is being passed on to you, that you need to have the capacity to allow your SNAP ENT participant to meet that work requirement. But if not, you can look and see, like, does my current component offering allow me, my participants to meet that work requirement? And are there things that I could do to be able to easily allow them to get some additional hours to meet that? A great way to do that too is like maybe some supervised job search activities if you wanted to see about if you could add that as a component, or job search training. We actually have supervised job search in a lot of our states that the CEO operates in, but they were being underutilized. And so we were working with our state partners to figure out what activities could we have our participants perform independently that it still be considered part of supervised job search, and working with us to kind of look into what that framework would look like. And it's basically like they're still coming in, they're still doing job search on site, they're still we're still giving them coaching on how to look for jobs and things like that. But we might send them home one night and say, hey, we want you to apply for X number of jobs, and you need to spend this much time doing it, and you need to document what you've done. But that allows them to then bring that back to us and verify that and still count it as some of that supervised job search activity. So you kind of can think outside the box a little bit and work with your state partners on what they will allow you to do and not, to allow your participants to get those extra hours that they need. But you want to look into your own program and understand, do you have constraints? You might not be able to expand services, or you might be fully tapped out already, or you don't have the space, but just looking for opportunities within understanding what your constraints are, what your own internal barriers are, and see if there are options that you could try to remove those barriers to get those extra hours. And then another thing too is having a really strong referral network. So understanding places that your participants can go where they could volunteer. Understanding places that they could go to other possible employment and training providers that are offering a complementary component that you think would be suitable for them. Those are things that you could be doing to be helping your participants. The other thing that also is often underlooked at and sometimes considered to be maybe a bad thing, but where we see a lot of non-compliance is with provider determinations. You might have a client in your program that you've enrolled in, and at some point in time, you realize that they're not really a good fit for your program. And either they're not able to complete it, they have some barriers that you can't overcome that makes them no longer a good candidate, or they're not able because of a new, in our case, what could happen a lot of times is they can't come to work because they're justice impacted and their parole officer has mandated that they go do this program that happens during their work activity. And so you might have to do a provider determination to send them back to the eligibility staff to say, like, hey, they're no longer a good fit for my program. But what that does is it allows the eligibility team to look for alternatives for them to try to get them sourced to another place. So you kind of have a you have a responsibility as a provider to make those provider determinations and making sure that we're sending our SNAP ENT participants back to the eligibility staff so that those case managers and workers can figure out some better models. But again, having a strong referral network and partnering with people in your community that can help them meet that work requirement is key too. So next slide, please. So I covered a lot of this already, but also how can you expand the support that you are offering? Documentation. If you are able to help your clients have a strategy for each month on how they're going to document all of their hours from the various sources, then that is a great way that you can work with them and making sure that they're getting all of that turned into the eligibility workers each and every month and maintaining that. Co-enrollment in other programs. Again, that's where that referral network is going to be really helpful. If you understand these other programs that participants can go to try to meet those hours, that'll be helpful. Leveraging your ENT supports to make sure that they're getting to and from where they need to go in order to meet that work requirement. And just staying in touch with them, tracking your participants' participation, and making sure that that job search training, supervised job search, isn't going more than 50%. of the other activities, because then it's not going to be counted. Making sure you have an eye on that if they're participating in those activities. And then, lastly, probably most importantly, is having that trauma informed approach. Some of the people are, who are now subject to this work requirement, they might feel a little bit helpless. They don't understand what they need to do. They don't know how they're going to do it. They might have some significant barriers that, still doesn't qualify for an exemption or a waiver or anything. So really just, being empathetic and making sure that they know that you're there to help, and that to try to bring clarity to the problem, and be have a solution oriented approach to trying to help them solve that, are all things I think are going to be very helpful.
There's a question in the chat. It looks like, sorry, go ahead, Aaron.
No, go ahead. Yeah, so I see, I'm all off. So if it's the last one from Olga, it says, if our program is putting the hours in vocational service and appeals system, does the participant need to report it on their end? So I apologize because I'm a little ignorant on that terminology. I'm assuming that's what that state's SNAP ENT reporting system is called. Is that what that is? So generally, get clarification, but generally when you are reporting your attendance into the employment and training, that is generally going to get, or states are trying to make sure that gets passed over to eligibility. So eligibility, that's automatic. But you definitely need to verify whether or not that happens or not. Because in some places, it's still the participant's responsibility to get that information over. I don't know, Andrew or Riley or Sam. Yeah,
I'd like to add to that. So yeah, we, hi, Olga. We work with the state of California, mainly LA County, but it is the requirement so it's incumbent on the participant to submit their hours. Now, I do know in LA County that, the folks who are providers and they're submitting hours based on the ENT work that ABODs may be engaged in, that's going to be considered as backup. So it's incumbent on the participant to submit their hours. That's going to be the initial documentation, and then anything that comes from the ENT providers is going to be documentation to back that up.
Yeah, I know I can only speak really that I'm like super knowledgeable on like Oklahoma, Colorado, Georgia, all of the hours that we report at those states, they automatically get transferred to eligibility. But I like you said, Dina, like California, I'm not as well versed in how that works. So,
Olga, I know remind me which county San Jose is in?
Santa Clara.
Okay, I think they do have a process and a form for that. I will follow up with you though, with whichever answer I find. But good question. I will also say I have a hard stop at noon, so I can either make Aaron or someone a host to continue the discussion portion if we want to keep going, or we have to stop right at noon.
We have just a couple more slides, I believe. So okay. I think we can. Sam, I can stay after. So if you want to pass it to me, I'm more than happy to do that. Okay. So resources, this will be available to you. But yeah, these are areas that you can go to just kind of school up, or if you want to be an ABOD expert, or you find this really, really exciting, then these are some resources that you can go to help educate you a little bit more on those things. Again, really, really rely on your state and county partners, because those are the ones that you really want to be working with closely to make sure that you're supporting your participants. So yeah, I think that's really what we wanted to cover here. And Sam, we'll just pass it back to you.
Yeah, so just really quickly, because like I said, I do have to jump. Thank you for attending today. We have a bunch of resources which I'll send out in a follow-up, including some documents about how to support time-limited SNAP recipients or AVODs. And then be on the lookout for July 9th, our Mapping SNAP Eligibility and Referral Community of Practice training.